Hello, my name is Alexis Foster and I'm a research fellow at the University of Sheffield. Today I'm going to talk to you about a study we undertook exploring the implementation of patient-reported outcome measures. Now, the reason we've chosen these two pictures on the first slide is that it illustrates what people's experiences of trying to use outcome measures. On one hand, you've got this kind of idyllic hope that you just decide you're going to use outcome measures and they become part of routine practice, and the reality then of trying to do them. So patient-reported outcome measures, more commonly known as PROMs, are questionnaires that enable an individual to rate their health, symptoms or well-being. So we're looking at what the person feels in terms of their pain or their well-being or how depressed they feel, rather than getting the clinician's perspective. If someone completes the same questionnaire both before and after receiving support, we can try and start to see how their health or well-being may have changed. And we can actually kind of collate the outcome measures scores of a number of different service users to try and get a general sense of whether there appears to be an improvement from people accessing the service. Some of the examples of PROMs that you might have come across include the EQ5D, which looks at quality of life, the Warwick Edinburgh Mental Wellbeing Scale, also known as the WEMWEBS, which looks at wellbeing, and things like the PHQ-9, which measure sort of symptoms of depression. Increasingly, PROMs are being used within services to try and demonstrate their impact. Now, one type of service involved in delivering health and social care are voluntary sector organisations. Voluntary sector organisations are things like charities and community groups, and they're also sometimes known as third sector organisations, non-governmental organisations or not-for-profits. They're often having to deliver PROMs in response to commissioning contracts. So, for example, they might receive short-term funding from an NHS provider or through a local authority to deliver a specific service, and they have to use PROMs to demonstrate whether they're having an impact to make a case to secure further funding. But actually, voluntary sector organisations often really struggle to use PROMs, and stakeholders wanted us to find ways of identifying the things which work and the barriers they experience to implementing PROMs. Given this, we designed a mixed methods evaluation where we explored a number of different aspects. First of all, we conducted a systematic review of reviews to explore the implementation of PROMs in clinical contexts, so things like looking at the research already done in oncology and palliative care to try and build up a kind of framework of implementation. We then interviewed a number of voluntary sector stakeholders, and this included commissioners, managers, frontline workers and service users. We took those findings to then support two voluntary sector organisations to actually implement PROMs themselves, and we utilised a community-based participatory research method to do that. And then we integrated the findings. To underpin our research, we actually used the Consolidated Framework for Implementation Research, also known as the CFI, and that was really useful both to kind of inform the study, so for example things like topic guides and issues that we should explore within the interviews, but also as an analysis method. But actually our kind of overall findings sort of then moved on and transcended the framework. So what we found was that actually many of the factors we identified were bidirectional. They could be a facilitator or a barrier depending on their delivery. We found that there were both contextual and process-related factors, which I'll talk to you more about in a minute. And some factors were very kind of specific to the voluntary sector organisation, especially this kind of needing them to demonstrate impact to secure funding and the use of volunteers within services. But what we found was actually many of the findings we came were kind of consistent with factors emerging from other clinical contexts, which indicated to us that there was sort of general learning that could be applied irrespective of the specific context implementing PROMs. What we also found was that even if we know what some of the barriers are, actually organisations can't always do anything about that. So we developed this kind of framework of implementation. Around the outside, we have 3 different types of contextual issues that appear to impact on implementation. First of all was the external context. People were implementing PROMs because they needed to, because of what their commissioners wanted. There was the context of austerity in terms of increased pressure to try and get funding. But also other external context issues were things like needing the support of researchers or experts to support organisations. Why would they have this knowledge on PROMs? So for example, with some organisations, we're actually going out and kind of helping them identify which PROMs that they could potentially be using, because why would they know otherwise? We then also have the internal context. So these are things about the organisation which appear to impact on implementation. So we had things like size. So for example, larger organisations might have in place things like a data management system or a data manager to support implementation. Structure, for example, were the managers closely working alongside the frontline workers so they could sort of support them with utilising outcome measures. How many resources were organisations able to invest into implementation? We then had people, and these were absolutely key to implementing PROMs. So this was both things like the frontline workers, and a lot of it came down to their attitudes and whether they bought into the concept of PROMs. Was there a kind of strategic commitment from senior managers to utilise PROMs? We found that service users had really mixed feelings. Some just expected to use PROMs. Others, it was really kind of made them quite anxious having to complete PROMs. But one of the key things with the service users was that it was really important to feed back to them their scores, so that it wasn't that you just took the information from them, but you actually kind of used it with them as a kind of discussion tool about, oh, actually you seem to be improving on this, but this area we could perhaps give you more support with. And really critically, you needed an implementation lead. So this was someone who had responsibility within the organisation to progress PROMs, and they actually needed to be brought into the concept of PROMs. So for example, where we were supporting 2 voluntary organisations with implementing PROMs, one implementation lead really saw the value of using PROMs and wanted them to be used within their organisation, whereas the other implementation lead didn't necessarily believe that PROMs were the most valid way of capturing impact, and she was doing it because the organisation had to, and that really impacted on implementation. So thus they're the contextual factors, and within that there was a kind of implementation process, and these were kind of overlapping stages, and actually there was a lot of kind of movement between the stages. So first of all, we kind of needed this kind of organisational commitment to implementing PROMs. We then needed to design a PROMs process. So that was things like choosing which PROM to use, deciding how it be administered at what time points, but also thinking about, well, how will the data get from the kind of frontline workers collecting the data to getting into the data management system? Who will analyse it? How will the data be used? People talked about experiences of there being packs of questionnaires sort of just on people's desks, which had been completed, but no one having done anything about. We then need to train and engage staff, and that's both practicalities, but also the kind of reason why we're using proms, so that people understand the kind of sort of validity underpinning them. Organisations would then start to try and use proms in routine practice, and often that this required a kind of trial period and a lot of kind of iterative process. So trying something out, finding it didn't work, such as kind of the time points you're collecting it, or the systems for the frontline workers getting the data into the data management system. We then needed to kind of reflect and develop the proms process, and sometimes that was making these tweaks, but sometimes it was actually going right back to the first stage, so actually finding that the prom that you'd been utilising wasn't particularly helpful and starting from scratch again. And then over time, proms may become part of routine practice, but they may not. For some organisations, they didn't sort of get beyond kind of having to start to use proms and them not being collected regularly. Throughout all this process, we really encouraged organisations to take a collaborative approach. So this was things like, rather than the commissioner imposing a prom on an organisation, they actually worked and had a sort of dialogue with the organisation. And again, rather than the managers designing a proms process, they actually designed it in conjunction with the frontline workers. Now, one of the things that we did was support a couple of voluntary sector organisations with implementing proms. And there was this presumption that collecting proms would be an upward trajectory, that as the frontline workers got more used to collecting proms, they'd use them more regularly and collection rates would increase. But actually, as this graph shows, collection rates have increased a bit, plummeted. And we identified that the reason for this was that actually frontline workers needed really a lot of ongoing support to remind them to use outcome measures, to keep checking in with them that there was no issues, because otherwise frontline workers would forget or sort of choose not to use them. So there was a need to have really active ongoing training. So for example, having it as a standing item within clinical supervision. So just to summarise, organisations are trying to implement proms, but it actually takes a lot of time and resources. And there's a question about, well, who funds this? Who's paying my staff time to attend meetings to decide which prom to use? Who's going to be paying for my data manager to collect the measures? We need greater collaborative measurement, so that's where commissioners and organisations perhaps work together. Whatever your experience of implementing proms, each organisation is going to come across potential challenges, and it's not always possible to address those barriers. Each organisation's implementation journey, but also their prom process, is very unique to the organisation. And because of the kind of time and effort it takes to implement proms, and as you saw from that graph, it doesn't always mean that proms are collected. It indicates that for some organisations, it may be more appropriate to explore other ways of trying to demonstrate impact rather than using proms. Now, thank you ever so much for listening. And if you want to learn anything further about the project, there's some links on the slides about where you can kind of find out more.